अभिषेक मैं तेरे को Well, good afternoon, everyone. It is so amazing to see that we are already 100 with our participants. So, thank you so much, everyone, for your time today, especially on Sunday afternoon. Uh, we all are glad to see this amazing response. Uh, and with this 100, we have also ensured that our participants would not miss it. So, we also made this session live on our YouTube, so it is also available there as well. Uh, well, once again, welcome everyone to the Rajasthan chapter webinar, uh, which is about restarting. And what we are saying is, let's get back to work. Uh, we have our three eminent speakers from three different industries today, which is one of its kind session for very first time in GSCS, which we are bringing for our participants. Um, I'll just quickly read out the guidelines for this session today, and then I'll hand it over uh, to our one of the moderator. Uh, so we have kept everyone on mute. This is for the purpose of not disturbing the entire session. So all your comments and questions are to be put in the chat box, which will be picked up by our moderator. So all you can drop all your comments and the questions in the chat box there. And along with that, we would also request everyone to keep their videos on off mode. This is just to avoid the latency while the session is going on. Of course, not for our moderators and speakers. For rest of the participants, please keep your videos off. Thank you so much. I'm just passing it over to Mr. Mukesh Purohit. Mukesh, over to you. Thank you so much.
Yeah, thank you so much, Jatin. And namaskar, adab, sat shri akal, vanakkam. I, Mukesh Purohit, your host for the day, welcome you all on behalf of Global Association for Corporate Services, that is GACS, for the long-awaited learning and knowledge session on three different sectors, as informed by Jatin, that is health, service, and manufacturing. Without wasting too much of your time, I would like to introduce and invite our first eminent speaker for the day, and he is Mr. Abhinav Bantia. Abhinav is Director, Manu Yantralaya Private Limited. In 2003, Abhinav Bantia, after completing his engineering, he joined his family-owned company, Manu Yantralaya Private Limited, which primarily supplies bearing and automotive components to customers in India and around the world in countries like Germany, Portugal, Italy, Slovakia, Bulgaria, China, Argentina, Indonesia, Vietnam, USA, UK, South Korea, Japan, etc. There are three manufacturing plants under this company located in India. In 2012, he formed a Japanese joint venture company and have diversified into plastic components for automotive industries. Manu is the only Indian company in bearing industry who won Global Best Suppliers Award for quality and delivery from the global bearing giant SKF. They have also been a zero-dimensional defect supplier to all their customers for last 15 years. The company has been recognized for its performance by the Indian government and various customers on regular basis. Abhinav Bantia has been the chair of Jaipur chapter of Young Indians, which is a youth organization for social cause. He currently is also part of Council of Confederation of India Industry for state of Rajasthan and is leading startup innovation vertical. He is also a board member of entrepreneurs organizations of Jaipur region. So help me in inviting Mr. Abhinav Bhatia. Thank you. Over to you, Mr. Abhinav.
Uh, Thank you so much, Mukeshji, for that elaborate profile introduction. I hope I'm audible to everyone. Is that okay? Yeah. So, thank you, GACS, to invite me as a panelist for this session where I can share some of the practices or culture which we are following in Manu to get our employees back. Just to give everybody a background, we are a MSME, so we are not a very big OEM or a large scale company. So the problems and struggle point which MSMEs faced in this pandemic were one of its kind. And and what we have realized is this is not going to be one of its kind episode, and we have to live with this new normal. And a lot of innovation and disruption needs to be done when you are coming back to work. So I have a quick presentation. I would like to share my screen now. One moment. Yeah. So just quickly, we are a company based out of Jaipur, formed in 1988. We have 4 plants now in Jaipur, and we have various warehouses across the world. We make parts for automotive application, primarily bearings, and have been approved by many OEMs since we supply directly, indirectly to them. Just a important thing in the slide. I think it will have a significance when we come to get people back to work. Our absolutes of focus in our employees and in our management has been to have focus on our customers. Our goal, uh, sorry, I think, yeah, our goal has been to do it right the first time. The method has been continuous innovation, control of processes has been customer feedback, and people, which is very important pillar of our excellence absolute, is caring. We focus on caring on our team and our employees and their families. And style of working has been teamwork, which has helped us अचीव ग्रेटर गोल्स. वो कहते हैं एक और एक दो नहीं होते, एक और एक 11 होते हैं. सो प्रोबेबली एट आवर कंपनी वी ट्राई टू फॉलो दैट, एंड दैट टीम वर्क has unleashed a lot of good results. Reward is always important. When you do good work, you need to give recognition and security to your team and your employees and your stakeholders. So I'm giving you a historical background of the company so that you understand when we are calling people back to work, how easy or how difficult it has been, and how companies can probably get one or two ideas to work with their employees. We started with 15 people. Currently, we are a strength of 320 people. The company has shown a complete sense of security to its employees by creating an environment which is good and comfortable for them. Uh, the advantage has been that these people have paid back to the company with giving full. They're not even 100, I think 120%. And they have been taking care of the products of the company, and we need not have additional checks or additional uh, what do you say, counter checking machines or employees to verify the product, because everybody believes the company is their own. How has that happened? That is coming in the further slides. But it is very important to make your employees feel that they belong to the company. Company is their own. Unki company hai. Kyunki end of the day, we are just the management which is running it. But whole energy or the brand which the company comes out in people's eyes is because of these employees who are working day in, day out. So below you can see some of the recognitions worldwide which the company has got, and a small company of our size getting recognized at a global platform for engineering product is not a normal thing, and especially out of Jaipur. Just to give you a picture of the plant, how we keep our plants area, and what kind of ergonomics is available for the employees to work. There is complete dignity of work. So this is a very important point when we are calling back our employees. There is no if and but, or nobody asks that whether we'll feel safe or there will be some issues, because they trust the company, because the environment the company has given them from since beginning has been the same. The director, that is me, and the sweeper or the driver or the operator wears the same uniform, same clothes. It's all work are as important and as critical for the quality of the product as I mean, everything is as important as even the smallest of the works. In the left, you see the white person. He's gone to Japan and he's operating the machine. He is the current plant head of the company. On the bottom picture, you see the guy in the frontmost wearing a jacket. He is probably the cleaning staff there, and the lady there is probably the inspection department of quality. So everybody is same in the eyes of the company. Some good things which we do to build synergy in the company, pictures of those good times before COVID. Of course, we couldn't do it in real time, but virtually we did a lot of things in COVID. We have 35% female employees in the plant, which is a uniqueness for an engineering company. That shows that commitment company gives to even equality of work opportunities for both the genders. And I'm proud to say that probably the women in our company are delivering much better and probably adding to the quality of even the male employees because of their work style. We have been blessed to have very low attrition rate, but there has been a lot of hard work gone into that. I'll come to those things. 2018, we completed 30 years. So these are pictures of 8 employees who've been with us for 30 years, and we recognize them with some small gifts. Bottom 2019, we further recognize few more employees who've been with us for 30 years. So the trend is continuing, and we are happy that Manu family is growing in a healthy way. So these are some for a MSC. Of course, big companies do follow this, but for smaller companies, doing these things is also a big gesture. We understand what it is to get salary on time, but the management has himself worked in companies and he understands the value of the check which comes in the first week of every month. So we have ensured that before 7th of every month, everybody gets his salary, also bonus, increment, PF, ESI, everything is on time, and the employee doesn't have to think twice about any small issues such as the general HR activities. Even in COVID, when we were sitting at home, we ensured that 85% salaries of all employees is reaching their bank accounts. And even after that, with limited manpower, when the people who were not coming were getting 85% of their salaries sitting at home. So we tried to take care of as much financial stress. Everybody was going out in the market. We tried to do what the company could do at its best. These are some practices of training which we do for our employees. I'm just skipping these slides. So I will pause here. So there is a unique thing which we do for our employees. This is basically 3 needs other than roti, kapda or makan. There is something which we try to go beyond. And when we are saying, let's come back to work, why our employees have come in full swing and why they have got more employees when we wanted to increase our manpower has been so easy for us. I think this Bible of our employee welfare policy has been a blessing for us. We came up with this, I think, 10 years back. I'll just quickly go through it. We have 35% female manpower, as I mentioned, and most of them are young girls who get married and then shift to another location. We understand if a father is sending a daughter to work at a company, it must be the family must be going through a lot of financial stress. So what we do is we give a kanyadan to them when they leave our job, and it's 1,000 rupees into month they work with us. So it can be 5 years, it be 60,000 rupees above, and it's above all the other regulatory stuff which we have to pay them. So this makes sure that even if the girl is there for 2-3 years with us, they know that company is for them and it's their own company and we're thinking for them. So that's one of our important policies. It's under my daughter's name, so I can't even stop this policy ever. Another one is the home loan policy. Anybody who's with us for 7 years. So please understand, we are a MSME. The average salaries in our companies are around 20,000, maximum 25,000. So for a person of that salary background, getting a house with 7 years of job loan for a house is a phenomenal thing, because if he goes out to a bank, they would charge, or NBC would charge 20%, 15% interest. But the company, using their bank limits, gives the same loan without any checks, because we know this employee is asset for us. At the same 10% rate, we give the loan to this employee, and he can build his house. So we try to absorb his financial stress to build his house. After retirement, we make sure that he should have a house if he retires from Manu. There is a family policy wherein we recognize if they go for family planning and have only one girl child, we would recognize them with 35,000 rupees cash prize. This is just a social thing which we do. We try that our employees can give good life to their children by not having too many children, which their salary cannot justify. It's strange, but yeah, because we want to have a boy, the people sometimes go and have two, three, four kids, and the life which the child gets is not the one he could have got with the financial background of the family. So we try to promote this in the company, and we are happy to say that a lot of people have been benefited with this. Uh, the other few policies is a scholarship which we give to all children of our all employees from class 1 to 12th. We sponsor their education slightly by providing 7,000 a month for the first two childs. Uh, so this is another small amount which we try to give to our employees so that they can have a good education. And we understand that we cannot create jobs for everyone. So for higher education, we give a 1 lakh rupee scholarship to employees kids who score 70% above in 12th standard. So this has been a great policy, because we've been able to get doctors and engineers out of a unskilled manpower which we have in the plant. His son is a doctor and another one is a engineer, and I think the social mismatch we have in the society, we are probably going to reduce it by doing small things like this. And there are a few more: attendance, family support. I'm going to go to the next one. So what I'm trying to say is these policies are small gestures which company does. This has we've been doing this in the good times, and when the bad time pandemic came, I think employees did not feel well, I think totally with the company, and whatever policy we came out, they were 100% with us, and we could really come strong, and currently are really running all our plants at full strengths. I'm just going ahead, skipping some of these slides. I'm pausing here again. Each employee, operator, setter, or senior setter, we call the senior experienced guy a setter in the company, or a team leader, are owner of their machine and the product quality. They think that the plant is theirs. There is no supervisor in the company. We don't supervise. You see this right picture in which there are a lot of girls sitting. This, anytime you visit Manu, you'll find it in the same condition. There is no supervisor seeing the job of these girls. They'll come, they'll do their job, they'll pack it up, and they'll go back. There is nobody to check them, because the environment somehow in last 32 years have come to us such a way that there is no need for a check. Everybody works with his own responsibility and onus of quality. Now, coming to the initiatives, of course, COVID was there, and we wanted everybody to be safe and secure. When they come to the company, they should be not taking back anything with them to their families. And also, while coming, they should come in the best hygienic way they can. So we did a lot of innovation. All our employees, because there was no third party available to do it, and we probably started on 22nd April, our SEZ plant, and everything was fabricated in the plant by the team before they started working. The sanitizing stands, the door handles were changed to an elbow handle, foot pedals in different plants. Everybody did a different innovation to do this. Some lever mechanism to drink water, some electric operated water stations. So a lot of innovation happened, and we recognized all of them because it was done in-house. We created a SOP, we created an emergency plan so people feel comfortable. The family's list was taken if in case there is a emergency, or if there is a threat of any COVID virus infection coming in. How do we plan this? Who's going to coordinate everything? So there was a lot of work which the company prepared to give confidence to the team. And we did a Zoom open house with all the team members. Lucky to us that we have the access of internet even in villages now. So everybody was in the open town house, where we gave them a brief before they came to the company and made sure they feel safe when they are there. there were norms set for traveling in the bus, which we have for the employees. And there was a vitamin tablets given to them also, to feel that something company which we can do for our employees, we should do that. So yeah, small things, water bottle, separate water bottles, hot water facilities for somebody if he feels some irritation in his throat. So small things which we try to do. There was instructions given in Hindi with the government guidelines. I think most of the companies did this form check when they got the employees in, the temperature checking, oximeter checking. So yeah, lot of things, lot of efforts went in, but it was a very smooth change because the people thought that it's their company. And despite pandemic being such a huge thing, as our experience of our company, we could manage the whole thing very smoothly. We had infections, but people were good enough or honest enough to tell us that I am infected and probably I will not come home, because we had assured them that your salary will not be, you will not get a, you will get a COVID leave and the payment will be done to you. So the confidence was there that we should take care of the company should not stop because of virus. If there is one or two cases, they will probably take a break. Some more pictures how we sanitize the areas, and of course the canteen and the training. This is me on 22nd April giving the training, because of the day one management had to show their presence also. So we came to the plant and we tried to meet with whatever people were there with all the safety norms and get the plant going. uh, at times leadership has to come stronger. Is the worst times when it's a difficult time, that then the leaders have to come and show that they are there with their team. And probably me, my team leaders and everybody was there to make people feel good. The time was very bad. It's come back in a good way now, but the sales were down by 35, or that time 35% probably. And we took a call that nobody is going to be fired or removed because of reduced sales. On hindsight now, I think because demand is so high, it was a good decision. But at that time, it was a financial decision a lot of companies were taking, and we did not believe in that. We said if 2 years the lockdown stays, we told our employees we are going to ensure that you get all your salaries in your account without coming to the company. That was the commitment we showed to them. And I think everybody was happy. And these are some salary sheets which probably my team has put here, that amount which we have paid to all our employees when they were sitting at home. We also took care of our suppliers, because they are a very important point when we get back to work. So all the checklists which we made, we shared with everybody, not only there, but I think in Mahindra World City, where our ecosystem is, we shared whatever best practices we were doing. And we tried to get the data from them also. We did audits, virtual audits. Even our OEM Maruti did a virtual audit with there, where they went and saw all the facility through the mobile phone, whether we are following it, because the whole supply chain needs to be strong when we are getting back to work, and the infection should not create disruptions in the supply chain. So yeah, that's a brief presentation from my side. I'll be open for questions. I hope I was summarizing it well, because it's first time I'm giving a presentation on COVID norms which we did. So thank you guys. Thank you.
Thank you so much, Abhinav. And it was actually a wonderful piece of information, because I believe is that we all have gone through a tough phase, and now gradually resuming and getting used to the new normal. And again, as you stated and emphasized, that any organization or business without understanding its real asset, that is its manpower, may grow, but not an expected pace. But whereas the organization who take care of their manpower and the asset, that is their employee, if they are well taken care, then the organization may have exceptional growth, because the yield will increase. So thank you so much. And if any participant has any question, we'll take those questions at the end of the session. And moving ahead for the day, I would like to invite Miss Shinu Jawar, and she is Director Apex Hospital. Ms. Shinu is one of the directors of Apex Hospitals, a family-run organization established in 1994 that now runs three multi-specialty hospitals in Rajasthan. Apex Hospital was set up in 1994 as a 50-bed setup, as was the conventional practice at the time. The vision to scale came after two of the promoters, including Sheenu spent a few years working in the NHS UK. Realizing that Jaipur at the time was too small to spread the learning of clinical governance, in which Sheenu worked for the 750-bed NHS hospital. She also independently became a first generation entrepreneur and founded India's first clinical governance and audits consulting with firm Ace Vision Consultants in 2004. Apex and ACE became the single entity for providing health and hospital care for a much larger catchment area beyond Rajasthan. In 2009, E&Y recognized it as one of the top 10 consulting firms in India. Soon, that led to a partnership with a European firm. ACE has also been invited to be a knowledge partner for the healthcare audits with one of the most progressive states in India. Meanwhile, Shinu was invited to work as a public health consultant to the Rajasthan government under a World Bank project. Shinu is a certified NABH assessor and a prolific writer and speaker, has been published in the BMJ South Asia edition. She is a chartered member and on the board of CII Rajasthan, a community with a turnover of 12,000 crore and total employment of 30,000 people. She is also on the State Council of CII and vice chairman of its vertical Indian Women Network. She is an alumnus of IHMR, that is Institute of Health Management Research, LSHTM, London School of Hygiene and Topical Medicine, and attended Management Development Program at IIM Ahmedabad, University of North Carolina, Chapel Hill, and at Harvard University. She is mentor to healthcare startups with Lumus based out of Hyderabad and Startup Oasis, a Jaipur based incubation center, which was set up at the joint initiative of RICO, that is in Rajasthan, Premier Industrial Promotion Organization, and the CIIA, Center for Innovation, Incubation and Entrepreneurship at IIM Ahmedabad. Over to you, Ms. Shinu. Thank you.
Thank you very much. Am I audible?
Yeah, very much.
Yeah, great. So just a little correction. I used to be the vice chair of IWN, but now the leadership has been taken over by a very, very competent team. But yes, it was a beautiful journey with CII, Indian Women Network. So thank you very much for this lovely introduction. And I think the beauty of working in several places is that you gain that much more experience about people and about different areas, different countries, and that adds to how you want to deliver these services. And we are all a service sector here. Thanks very much, the GACS, Global Association of Corporate Services. And I really identify with your mission. I went on the website and I saw to be the voice of corporate services fraternity, supported by an active, interactive platform for professionals across the globe. Of course, I'm reading this out. And it's really great to have this interactive session. Abhinav, you have done a really great job. Since I'm from the healthcare industry, so I will not be talking about the measures that we took inside the hospital because they were of a very, very specific kind, because we were not only preparing for our staff, but we were also preparing for the patients. But to see what Abhinav has done at his place is really commendable, and a lot of positive points could be picked up from there. So I would say that it has been 12 months since this problem happened. And today we are standing where a lot of us are already vaccinated, the frontline workers in healthcare, then the teachers are vaccinated. And it has just been a 12-month period. If you pick up the history of the world, you will realize that whenever pandemics and plagues have happened, it's taken years and years to come to this level. So tremendous thanks to the scientific community, to the healthcare workers, to the people who made this possible, to the funding which came in. And today, as it stands, we are talking about getting back to work. So to me, when we talk about getting back to work, it is not just getting back to work, but the term that I would like to use here is that we are trying to come back to productivity. Now, when we have to come back to productivity, there are a lot of things that we need to take care of. The three basic things that we all know to take care of our people and therefore of their productivity is taking the temperature, which we all are doing, using a lot of hand washing techniques, which we all are doing, and wearing a mask so that we do not spread the infection, even if we are a carrier of that infection. So beyond these three basic things, which the whole world, even a child, is now today aware of, what are the other things that all of us as a platform, we belong to, I'm sure we belong to different organizations here as a representation of GSCS, there are different organizations. And what is it that we can really do today and tomorrow? Because it is not a short-term activity that we are talking about. When we welcome our teams back, there is so much more that we have to do. So what is it? And all of these things are not something which we can do immediately. Some is going to be driven by policy, which maybe you and I cannot make, but the organization at its corporate headquarters will have to make. But as long as we all are aware of what we need to do going forward, we become one platform and one voice. I would like to sum up all of my thoughts into 10 different subheadings. First of all, I would like all of you to know that the government is also thinking about all of these things along these lines. And it's coming up from the 1st of April 2021 with 4 labor codes, of which the occupational safety and health of its people, of the working conditions, is going to be one labor code. And that is going to replace 13 existing labor laws which related to the health, safety, and working conditions of a workplace. So that is something which we will have to understand and relate to. Now, my first point is going to be, when we talk about people coming to work and we talk about putting these protective things into place, just take a step back and let's try and understand where that person is coming from. That person who's coming to the workplace is actually coming from his family, right? And he has to go back to his family. So if we are not going to address the roots of where this person is coming from, then there are 2 things which we are not going to be able to address. The first thing is that infection can be carried from the family into the workplace, and it can be carried back from the workplace into the family. And the second is that if the family is not going to be comfortable about the person coming to the workplace and carrying the infection back to the family, or himself getting unhealthy, then the family has a lot of concerns which are not being resolved. And the person can be productive only if he leaves a happy family behind when he comes to work. So I would suggest that the organizations should work on developing some sort of FAQs, not only of how the family members can address the COVID-related issues, but also what are we doing for the people at the workplace, and we relay this back to the family in ways of handouts or information so that the family is satisfied. Because a lot of times we have elderly parents at home and they get very worried about us. So I also understand that an organization which is not into healthcare cannot be legally responsible for creating these FAQs. In such a case, I encourage you to tie up with a credible healthcare organization. Information can be picked up from Google. It can be verified with a healthcare organization. And with that endorsement, you can carry out with this communication to the people and to their families. Data suggests that almost 2.7 billion people, that means out of 5 people, around 4 people all over the world, the global workforce has been affected by this lockdown. And either they were staying at home or there were all sorts of other effects. So that's a very large number that we are talking about. And a lot of issues have happened in the families. And this is going to be a very, very important part to address before we can make people comfortable where they are coming. So what is this? This is some sort of an engagement which goes beyond the workplace. Now, apart from this generic FAQs, the second point is, can we have some sort of a counseling desk or some sort of a person designate, some sort of an email ID where people can connect, where their concerns go beyond the generic concerns and they're more one-to-one concerns. So some sort of, excuse me, just a moment, please. I'm extremely sorry. Yeah, so some sort of a desk where families and people can connect to in case there is any problem or they want any kind of a counseling is going to be very, very advisable. The third point, of course, which picks up straight from the re-engagement is that we have understood the virtues of the virtual world, and people are coming up with hybrid models also. So Zoom technology or Microsoft Teams or any other platform through which we have been doing work from home or connecting with people, such as this platform, has become the household name. Beyond this, even in the workplaces, there are lots of technologies that we can now adapt to. I'll come to a very simple technology like the biometrics. So the fingerprint biometrics became, which was rampant everywhere, suddenly became obsolete because nobody wanted to touch, and the eye scan came in. Then with the biometrics, people used to crowd around one place or for the entry through one place, and that also became a problem. So can we look at various technologies which is going to help not only restructure the way we work, restructure the way we communicate, but also restructure the operations of a unit so that this kind of a contact, at least for a short term, can be avoided into the future. The fourth point, which is again going to arise from this, is going to be infrastructure. So people earlier would be sitting in a certain way, but there were no norms which were existent between what should be the distance between two people sitting and working together. Two things I would like to mention here. The first is that, again, data suggests this, and as a healthcare organization, we have observed that people who are typically found to be working together in closed environments for very long periods of time, even if it is the norm of 8 hours, end up with two kinds of problems long term. One is a dermatological problem, which is skin related problem, and the second is respiratory problem. Now, owing to that fact, this was known, but people were not paying a lot of attention to it because this was almost like a occupational hazard, that if you have to work like this, these problems may happen. But because of COVID, suddenly the world is looking up to how we can avoid these problems. I will give you an example from the healthcare industry. The healthcare industry is an area, for example, hospitals are an area where you have sick people coming in. And people who are sick may also carry infection. And that infection spreads because it is a place where all the sick people are getting together. So what happened is, and we have picked up a lot of norms from the army, that in a general ward, normally there is a mandate of 3 feet between one bed and the other. And this becomes a mandate of 7 feet between one bed and the other in the ICU. This is a scientific reason to avoid cross-infection from one patient to the other. Maybe when we look at the OSH law, which is going to come in, or the healthcare mandates which are going to come in, they may start talking about certain norms which must be followed by organizations with people working close together. So that is something that we have to think of, that given the existing places, given the number of people required to work, should we alter the routines? Should we alter the working days? Should we alter the way work is being carried on as desk job and field job? Or should we simply create this infrastructure so that people do not get afflicted by the disease or spread the disease? So this is going to be an important part of the way forward. My fifth point is going to come up slightly from the same concept. A lot of organizations may have had a safety officer, maybe some organizations don't, but just look at it this way, that what is safety? And are we really going to talk about safety now, or are we going to talk about wellness? So maybe in the future, organizations will have somebody who will have a role, but will have to pick up the dual role of also being the wellness officer. And this person will be accountable to ensure that in all the areas of working, he is responsible for the wellness of the employees. Certain checklists are made, they are monitored, they are verified by this officer so that everybody is assured that they're working in a place which takes care of their well-being, not just which sends them to a hospital when they fall ill. My sixth point is going to be, there is one department which is responsible for the people. Historically, it has always been responsible for the people, and that is the human resource department. I think now will be a time when the HR department is really, really going to come up. Because if this department is responsible for people, this department is also going to be responsible for their productivity. So we have had 1 year of almost a washout. The organization targets, the organization goals, the organization objectives. None of these have been met in the last year owing to this pandemic. When people are going to come back after that 1 year of being isolated, of working from home, then it's going to take them a while to get back to their normal selves. At the same time, there will be work pressures forcing them to come up with strategies and their plans to match up, especially not just with today, because we are a year into the future, but also for what we have lost in the last year. So to ensure that their productivity is enhanced, the HR department will really have to strengthen, find new ways of working, find new ways of motivating their team members so that we can come up with better plans into the future. My seventh point is going to be around the housekeeping officer. So far, this officer has only been responsible for the cleaning of the areas. But now three more terms are going to become a part of his portfolio. The first is going to be infection control. The second is going to be sanitization. And the third is going to be hygiene. So it is not just cleaning, but cleaning with clear-cut, measurable 3 deliverables. And this is again something which we will have to look at into the KRAs of this officer. The other point is, if you look at the Japanese culture, it is not just a certain category of people who are responsible for all of these 3 things. It is everybody. So everybody becomes a stakeholder in their working environments, hygiene and sanitization. Can we foster this kind of a culture into our organization with our policies and plans? My 8th point will be on disaster management. So, it's a very interesting thing. Whenever we talk about this pandemic, everybody wants to talk about only of COVID. And everybody wants to talk about only addressing COVID. But trust me, if we were to have a next disaster of this proportion, or if we were to have a pandemic, it's not going to be another COVID. It's going to be something else. In the last history then of the world, of medical history, we felt that we have won the battle of communicable diseases, the TB, malaria, Ebola, so many of them. Today we have learned to live with TB, we have learned to live with malaria. Ebola happened only in a certain part of the world. HIV is there, but it is not, world rampant, and people are living with it. We are living with it. But suddenly COVID happened and it just tossed everything, every thought process, and what we could not believe happened in the last year. The next time we have something like this, it's not going to be COVID because the world is prepared for COVID. All our disaster manuals are prepared or crystallized for known problems, something like an earthquake, something like a fire. Can we think about structuring our disaster management manual for the unknown? Now, how can we structure something for something that we do not know about? We do know something about something which we have not seen. Number 1, it will affect our people. Number 2, the government-led emergency departments and the healthcare institutions will be the frontline workers. Number 3, good health is going to be our biggest weapon against any pandemic that we are going to face. If we keep on working for the employees' good health, when we talk about the wellness officer, when we talk about wellness, the mental wellness, the mental health, and when we talk about having tie-ups with healthcare organizations, or when we talk about having tie-ups with the government agencies, having their numbers with us, informing all the people of what is going to happen in case we are hit with another unknown disaster, what will be the communication pattern that is going to come into force. At least these 3 things can find a place in our disaster manuals. And this is something that we should work on. The ninth point, which is the second last point, is going to be that so far we have come across a lot of biases. We have come across disability bias. We have come across gender bias. Are we also heading into the comorbidity bias? It's a very sensitive issue. We have seen that people who had diabetes, or people who were elderly, people who had asthma, people who had cardiac existing conditions were the most vulnerable group for COVID. Our HR hiring policies and our HR policies for making such people comfortable in the organization will take paramount importance. We have to see things from both sides. We will always have these people in the organization. You and me, we could be one of them. But we also have to ensure that if we have to protect our workforce, we're not creating a bias, we're creating priority. These will be our priority people. So what policies will have to be put into force to ensure that these people are protected first and foremost as a priority population in our organizations before the more healthy individuals? Lastly, I would say that if there is one string which puts all of these nuggets into one structure, into one place, is affiliation for healthcare with a healthcare organization. We must look at it, and we must ensure that for a long-term innings, it is very, very important that we not just look at short-term targets and see to what we can do now, but we also look at long-term targets, and we put people first in our organizations, and GACS becomes a foremost association that brings it to the minds of all and sundry and alike. Thank you.
Thank you so much, Sheenu ma'am, for this wonderful knowledge. And before we go forward, I would like to convey the message from the leader, GACS Rajasthan chapter, Colonel VP Singh. As he was there in the session but had to leave due to the engagement in an important obligation, he conveyed his sincere thanks to all the speakers and the guests who attended this wonderful knowledge session. Moving forward, I would like to invite our third and the final speaker, Mr. Hemant Rajput. Mr. Hemant Rajput is a regional manager facilities at Infosys Limited. Hemant is an engineering graduate and management postgraduate with specialization in infrastructure and facilities management, administration, transport, audit, and compliance, with a passion for operational excellence and turnaround. He has been a naval officer to begin his professional career and has served at multiple GOs, with his last stint at Goa International Airport, overseeing airport airside operations, training, and information security. He has done his management course from IIM Ahmedabad and then joined Infosys. Since then, he has been leading Jaipur Business Center as a facilities head for the location. He is a certified auditor for ISO Environment Management System, certified lead implementer for ISO Business Continuity Management System, and certified professional for environment, health, and safety. He is an active member of CII IGBC, a founder member and part of Governing Council of GSCS Rajasthan chapter. With his significant professional experience of 16 years plus, he has been a promoter and speaker at various forums. So over to you, Mr. Hemant Rajput.
Hi, good afternoon. Just let me know if the screen is visible to all.
Yeah, you're audible and screen is also visible.
Okay. Thanks, Mr. Mukesh, for that lovely introduction. And I've been honored to be part of this August panel, and speaking after Mr. Abhinav and Ms. Sheenu makes it slightly more difficult for me because the bar is already set so high. Anyways, I'll try to do justice to bring in the perspective from the services industry on what this pandemic has brought to us, and I'll be sharing some of the experiences and snippets of what uh, professionals in the similar industry can try to get into so that it helps them sustain their operations. So I'll have my presentation just revolving around these four simple topics. That's what are the stages to start. We'll be talking about several checklists in different areas of operations, what we should consider before reopening the setup, certain general norms, and last but not the least, what if something goes wrong? Are we prepared for that, or what we should consider to be prepared for that? So when we talk about restarting after such a pandemic, wherein several industries and workers have been totally out of work for a significant time, and then certain industries have started getting back to work in a gradual manner. Different locations, different places, different timings. So the first and foremost decision is for any of the organization on and the leadership is when to restart. So the timing and the location will have a lot of factors to be considered. This will be your health conditions in the state and the city you are working from the geos your employees are coming in, what are the government regulations around it, what is the healthcare industry significant enough and strong enough to support you in time of need. So all these factors will play a major role to decide when to work and when not to start the work. The next important decision from the management perspective is going to be what is the risk appetite of that particular organization, and vis-a-vis what is the criticality of their operations. Should they start everything? Should they start partly? Or should they not start at all at that point of time? So these are the two things, the criticality of your business operations versus the risk appetite of your organization. So you have to weigh these two things into a balance, and then only you will be able to make a justified and informed decision. And then coming to the very, very important operational point is how to start. So the rest of the presentation is going to be around how to start. So as I said, the government guidelines will play a major role because that is something which is binding on all the industries. Then based on those from start to the finish, what should we be considering? What are your critical equipments and services? What are the various employee touch points? Because this pandemic is impacting humans, right? And so anything which is connected with humans, we have to consider all those points which will affect them during the work, coming to work, going back from the work, and the associated areas. And also, as I said, risk appetite will also guide on what should be avoided, at least in the beginning. So I've just listed down some of the important systems and services, more so from the services industry perspective. So as some of our previous speakers have also mentioned some of these points: housekeeping and sanitization, heating, ventilation and air conditioning, power systems, water management systems, food courts, your building services, fire safety, transport, security and visitor management, and to end with the emergency preparedness. So to begin with the housekeeping, this is one area, as Shinu was mentioning, has gained prominence and the scope has widened. So just to share a few quick tips that we can always reconsider if we have already considered our checklist, or if we have not begun, we can include in our checklist to make a decision is whether we have the minimum stock of essential consumables and personal protective kits. I suggest to have a minimum 30 days stock in hand when you want to restart your business, based on the lead time of several stocks and items that you need. Then training of staff is another very, very important factor. What a janitor has been doing prior to COVID and what he needs to be doing after COVID, there is a lot of difference. A lot of things have been added into his checklist. A lot of checkpoints, a lot of frequency change have been taking place. So that training and the retraining is a very, very essential part of it. Then equipment sanitization every time before and after use. We have been in a practice of either doing it before or doing it after. But now there is a need to do it both before as well as after. Similarly, in case something goes wrong, some person turns out to be a COVID positive in your office, in your workshop, there is a need to be doing a specific sanitization in that area. So you need to train your own housekeeping team to do that specific disinfection and the sanitization, or you may also like to outsource if you think that that expertise is not possible to do in-house. Now, when you're starting after a long time, there are certain quick tips anybody who is a housekeeping manager should be looking after. You can see for traces of moisture, you can see some growth of fungi. You may find rodents and the pest in your buildings or the work areas because it has not been operational for so long, and it is very, very normal and human that we have been missing out on these things as we used to do earlier. So look for these things very, very critically, because when you restart, you have to make absolutely sure that you don't have rodents which can hamper your work processes. You don't have these moisture traces or the fungi which can adversely affect your employees' health, and you can end up in another kind of problem. Sanitizers, hand wash stations, face masks, gloves, and social distancing. This is something which is a very, very must. Everybody, every organization, and the government is placing a lot of emphasis on that. We can't ignore it. And as far as possible, try to go touchless. It will not be possible for all the things, but you have to identify based on your setups where all you can minimize the touch points. Again, some quick tips for garbage disposal. We have been using single liner bins instead of that, to deal with this kind of biomedical waste, which we are handling now after this pandemic. So it is always advisable to have a double liner bin for the safety of your person who is picking up the garbage and then disposing it. A lot of queries have been coming to us who have been seeking, what should be done for the disinfection. A lot of commercial products which are there in the market. I don't want to name any of the product, but many products are pretty costly, and everybody is not so willing to spend that much amount of money onto that. So there are certain things which are very, very cost economical as well as effective. So these sodium hypochlorite solutions, for your basic sanitization, isopropyl solution, it will work as a sanitizer. Hydrogen peroxide will work for your air fumigation. So these are some very, very cost economic ways which you can consider. Coming to the next important aspect, we will be moving to the engineering services. And being an engineer, I can have a joke on myself. What do you see as an engineer when you see to any machinery? Should it move or should it not? So it's a very, very simplistic flow chart, you can consider. But coming to a serious point, coming to the HVAC, that's heating, ventilation, and air conditioning. This has been an area with a lot of debates, a lot of huge companies giving you certain advisories, as well as advisories coming from ASHRAE and ISHRAE. I have tried to break down in some very, very simple and effective points that we can actionize as a facilities manager. So first of all, begin with your air filters, cooling coils, and internal surfaces. These are your pipes which are used, whether these are condenser line pipes or your air ducts. See for those. Wash them, sanitize them, and very, very importantly, dry them completely by airflow before you put them into the actual usage. Otherwise, if you don't dry them, just wash and sanitize, it can again lead to molds and fungi inside those pipelines, and you will not even come to know till the time they do some damage. Then ventilation is very, very important. When dealing with this kind of virus, it is very important that you have the maximum fresh air intake instead of recirculated air. It will definitely increase your cost to some extent because your power consumptions will increase in these HVAC systems. But that is something which is a secondary importance as of now, because the primary importance is your health and your employees' health. So use the fresh air to the maximum possible extent and reduce circulations, right? Heat recovery wheels, at least for a time being, don't operate. That's my sincere advice. Don't operate them, because again, this will lead to a lot of recirculation. Chillers, as we will shortly will be entering into the summer months, will become very, very important for your workspaces. So have them at least service done for these systems. Check for belts, check for their refrigerant levels, check for gas pressures, right? Get the system checked. Similarly, get their panels also checked specifically, because that is something which you have not operated for so many months together, right? For your buildings, you should be ventilating them before the work starts up for the day. So it's a good idea, to open the windows for 1 or 2 hours before the work starts. So say, for example, if your office starts at 9 a.m., open your windows at 7 or 8 a.m., circulate the fresh air using your AHUs, and so that when the employees come, you have fresh air for them, which is absolutely healthy. Very importantly, earlier, what used to happen is in the industries, we generally used to keep a set point for the temperatures of around 22 to 24 or 26 degrees, right? With this virus, it is as advisory from the ISHRA also, you should reset your BMS set points. And these are some of the very, very important and handy set points which are put across. So CO2 levels should not cross 600 ppm. Temperature range, modify it, change it to 24 to 30 degrees centigrade setting, which is comfortable for the workers as well as conducive, not to promote the growth of the virus as well. Relative humidity is 40% to 70% range is a very, very comfortable range for humans, and that should work. Keep your workspace under the positive pressure and the toilets under negative pressure. Why I'm saying so is so that your all the stale air or the infected air always moves out from the system very, very effectively, and there is no mixing. So while we all do that, but just to remind you, keep it as a thumb rule. Coming to the power systems, so as we said, for the HVAC, similarly, these are another very, very critical set of systems. So whether you are in services or even in the manufacturing, goes without saying. So undertake this preventive maintenance before you decide to restart, right? So your critical items like your diesel generators, your HT and LT panels, your breakers, transformers, get them serviced, right? And when you're getting them serviced, it's again a good practice to see their job cards of what was the findings in the last service. Was there any outstanding point? Check for your earth pits and lightning arresters, because again, maybe after a quarter, the rains will also start. And if your buildings are not properly protected, if your panels are not properly protected from the lightning, you may end up in doing a larger damage. Check your UPS, check the battery performance, check your ATS panels. Very, very important for you, right? Similarly, certain general guidelines, your oil level checks. Again, I'm just repeating this point here specifically again, by intention, that is your rodent control and fumigation is important, right? If you have and you can do your thermal imaging, it is again a very, very handy tool. I specifically do it for your moving components, where you have hotspots. Do it for your junction boxes, distribution boxes, panels, and the motor components. This is something which we find over the years very, very handy to do a preventive maintenance instead of doing a maintenance post the breakdown. And my suggestion to you is, once your maintenance is through on all these critical systems, try to do a mock drill. This is basically to tell you, is your staff, your in-house electricians, your vendor partners who are going to be supporting you in case of a breakdown, are they also equally geared up to handle any kind of exigency? Water management, again, check your chlorine levels, which is very, very important. And what sometimes we do is we check the chlorine level at the plant level, whereas you're actually consuming in your buildings, right? So at the user end, it is a very, very good and recommended practice to check your chlorine level at the user end. So the ideal reading should be zero point 0.2 ppm. It should not be less, it should not be more. We all know the importance of pH, total dissolved solid, FRC, that's a free radical chlorine, and the hardness. So do those checks on a daily basis, at least for the time being that your plants are running and stabilized. In STP, because we are presuming that again, because of the lockdown, these have not been operated for quite significant time. Use your air diffusers and blowers to the maximum, run them continuously. And before starting your STP, check if the water has turned septic or not. If it has gone septic, you must dispose it completely, refill, clean the tank, refill it, and then only start operating. Otherwise, the septic water will recirculate into your systems and will give you a trouble for an even longer time. Right? Check for your drains. And again, because of the kind of work you do in the STPs and WTPs, fumigation is very important in areas inside and around the STP and WTPs. These are some of the parameters. You can search it. It's from the Indian Standard 10500 of 1991, which gives you a value of what should be the different parameters as far as your potable water is concerned. Coming to the food courts. So again, start with the pest control before you open, because this is the place which is the most lucrative place for any of the pest. They have a lot of things to party. So please disinfect all your surfaces, especially do a health check for your food handlers, because those are the people who will be coming into contact with most of your employees. And it is very, very important to have these people absolutely healthy. It's a good way to redo a training on the safe practices for them, and as well as on their personal hygiene. As I said, to reduce the common touch points, so taps, water dispensers, we have seen so many videos on YouTube, on Google, very, very cost effective ways to make them touchless. I'm not coming to any particular idea in particular on this, but you can always find a lot of innovations around it. Even during lockdown, we have seen certain innovations from Abhinav's industry as well. So all of those have done a lot of innovative things in-house without costing a bomb. So this is doable. Implement social distancing. You may have a single user per table or alternate seats, depends on what kind of setup you have in your cafeterias. Try to stagger your peak rush timings, like more so in the manufacturing setup or otherwise as well. Your lunch timings can be staggered so that people don't rush together and there is not a large gathering at any given point of time. You may also like to review your food menus, have simpler items, have those items who are not so perishable, and you may like to see what should be the meal sizing so that people don't waste. When I say don't waste, it also encourages them not to share if you have the smaller meal sizes in every food items. So these are the certain things which as a manager you can do at the back end so that your end user doesn't feel bad, as well as their health can be taken care. Encourage digital payments. There are a lot of apps which all of us use now, but thanks to the demonetization, we are in habit of it. Let's encourage that. And specifically in the food court, my recommendation is avoid alcohol-based sanitizers. Instead of that, promote hand wash with soap, at least in the food court. And for dishwash, use a simple 3-sink method that we all know: wash, rinse, and sanitize in 3 different sections, so that your crockery and cutlery is absolutely safe for consumption. Now, coming to the, again, a very, very important touch point from the employee's perspective is what you offer them inside the building. So your elevator is again a very common touch point. These can also be converted into touchless options. A lot of innovations has happened in this, but if you can't do that, increase the sanitization frequency of at least the lift button panels. So, you may like to do it every half an hour, every hour, or every 2 hours, depends on what kind of footfall you have in your buildings. And promote using a staircase so that there's a less rush into the elevators. You can maintain social distancing and all those things. Reception desk, where you have all the visitors, that can be modified. You may have some simple partitions to ensure social distancing. And which is very, very important for every one of us is a lot of awareness, signages, and communication has to go on this. This I'm telling you from the experience that we have been experiencing for last couple of months. Employees will take it very, very positively, but if you tell them in a very, very positive way, if you are able to communicate to them that this is for their own good, their health, their family's health, and they will be very, very cooperative on this. So these are some of the ideas that you can do. Coming to another important point of fire safety. So our recommendation is that you check your fire alarms and the firefighting systems thoroughly before you decide to re-operationalize and open it up for your employees. Your fire pumps, hydrant pumps, and portable extinguisher all needs to be checked. If you have your server rooms, your data centers, your water leak detection system, your pester system in those critical areas, again should be checked. And try to do again a mock drill here with your internal teams, your security teams, your facilities team. Check the NCPs, check elevator fireman switches, because these are the things which have been not been operated for so long time, not tested. So it's a good practice to test them so that it gives you a confidence that you are battle ready. Coming to another important, very, very important and emotional touch point for employees, more so in the services industry, is because you have a lot of employees. So transport. So my recommendation still goes to avoid public transport because you have a very, very less control over that. Discourage non-essential out-of-session travel, and very importantly, install a habit and a mechanism to have a daily health check of your transport drivers. Sanitize your cabs before and after each trip, and very importantly, while it is going to have a slightly negative impact on your costing, but ensure that you have a social distancing in the transport fleet as well. Possibly use only alternate seats at 50% occupancy. Going to have you a bit of pinch on the pocket, but it's definitely going to help you to sustain your employees to be coming to office. You definitely don't want them to get infected by somebody, and in a single cab 6 employees turning out to be positive because they were in very, very close contact. You can also decide to split shifts into multiple shifts so that you have less number of fleet required and you can repeat them for multiple trips and ensure the social distancing. Masks should always be mandated, and it's a good thing to have those masks and hand sanitizers available in each and every cab so that if anybody forgets it, at least the driver can tell them to pick up one and use it. Coming to the security and visitor management, as we already heard, the biometric is something which was very, very prominent, and now it is absolutely out of use. Also try to avoid non-essential visitors. The way we are meeting right now and connecting right now virtually should be continued to the extent possible. Importantly, have a mechanism to track your visitors. I'll use 4 Ws: who came, when he came, where did the person go, and whom did the person meet. This is very important because God forbid if the person turns out to be a positive patient, at least you will know who are the infected people or who are likely to be the people who came in the close contact. Certain things which I said, that these are some of the things which you can consider, you may try to delay them or at least not to start for the time being. And that's your personal visits, events, non-essential travels. Certain general norms which we all now are all aware. As I said, employee communication is very, very important. You judge your pulse of your employees. You convince them, showing your best efforts at what you have been doing as an organization so that they feel safe. Their families also feel safe that one member of the family is going to office, but it is absolutely safe to go to office and start working. Have a self-declaration made daily. This is also important from the organizational perspective, where your liability comes in as an employer. So having a self-declaration for both your staff as well as for the visitor is something which will help you in that, and have your HR policies which will support this whole transition. It's a very, very important point, many a times neglected, but you need to review your HR policies. Are they supporting employees to take leave if they are ill? Are they supporting them in the medical treatment? Do you have the sufficient insurance coverage for them? Is the work from home properly enabled? Do they have a choice to switch over back to the work from home mode if given a need? So have those review of your HR policies. And as I said in the beginning, this is something which also comes to me very, very naturally for being an auditor from the business continuity management perspective. Have your emergency preparedness. So are your vendors ready to provide you the necessary support? You may be ready, your organization may be ready, but are your vendors who are providing you the critical services, are they equally ready? Do you have the required medical services tie-ups or the or readily available who can help you manage in case of a pandemic, in case there is again a spike in the pandemic situation? Is your communication plan with the employee ready again, first to call them back to work, or in case need, go back to the older model? So the rollback plan with the specific limit that this is my threshold. If the organization is able to manage within this, we are okay. We can continue to scale it up. But if something goes wrong, this is the tipping point where we should be stopping. So have those plans ready, and all the best. Thanks.
So, thank you so much, Mr. Ahmed Rajput. It was a very enlightening presentation, and we got to know about a lot many things which we were not aware about. Now, I would like to invite Mr. Vivek Saxena to take up the queries and questions. Over to you, Mr. Vivek.
Yeah, thanks, Mukesh. Since we have a great knowledgeful session for all of us for the preparation going back to work, so definitely we are having the questions also on that. So I will start without wasting the time. I will start with Mr. Abhinav first. So, Mr. Abhinav, we all know that the COVID-19 pandemic hit manufacturers in an unexpected and unprecedented way. And this is for the first time, maybe the modern manufacturing history. The demand, supply, the workforce availability, everything get affected globally. So here we have a question for you that since you're taking care of your employees very well, the question is that what are the lessons that you learned from this pandemic, and which you want that definitely help you to avoid such situation during during it? If something comes like it, then what are your learnings actually during this time, if you can share that?
So there have been, I think, the learning what people like us have seen this time is a phenomenal learning. I hope we don't get opportunity to have use this learning for any time soon. But one thing is there, as an organization or as even an individual, what one has realized is that you need to keep liquidity in terms of finances uh, at a personal level, at a company level, because if a company is over leveraged or if a company is probably under severe debt, this situations like this can completely change the business. So very important thing for a business owner or a person who's running his house to keep a safe finance, kind of a safety stock or a liquidity which can be used in situations like this, because you never know how bad or how big it can be. So of course not all measures can be taken, but one important is that. Second, as Hemanji said, that you take you get your basis secured by taking decent health covers for your employees and have a strategy in place. If something like this happens or goes on, at least your basic health needs are taken care and you don't get further under pressure of financial pressure, which can be avoided with simple insurance policies. Lastly, we all understood the importance of digitization. I think companies need to take a genuine call and revisit their SOPs and procedures. That a lot of things are not required to be done physically, and things can be managed virtually. So why have make a strategy and plan to ensure that in case some emergency or another lockdown or a semi lockdown or situation happens, business doesn't stop, things can proactively go. I think it's a great time for industry 4.0, because a lot of things which were pending, or people investments were pending from companies to get into industry 4.0, will now get signed off very quickly. So yes, learning has been phenomenal in terms of keep innovating and trying to maintain all health checks in the company. I think that's what I can gather. Yeah.
Yeah, thanks for enlightening this. See, one question which I have on it is that we all are talking about the digitization. We are talking about the automation also. So, how actually automation help us during this pandemic time? Or we are in plan to have implement some more automation in process just to ensure the safety of the workers or the employees?
I think automation has helped everyone. People who were already running their plants. I mean, lot of things can be done virtually, but of course, there are some things which have to be done by hand, especially in manufacturing. You have to load the material on the machine, and the machine has to go on. But if you automize, probably the man who's done running one machine can run 5 or 6 machines. So that kind of advantage gives you a space in the plant, that even, of course, you're running physically, but ergonomically the distances can be maintained. So yes, uh, uh, automation will help a lot. Also, training which was done on a regular basis in a small group can be virtually done on mobile phones, with everybody sitting in their own seats or in their work area. So small things can be adapted quickly, but of course, getting robots and getting AI, that is a longer story, which will eventually happen when the cost goes down. But people are looking into that, and in bigger companies are rather investing in those robot driven AGVs in the plant to transport material from one station to the other station, or using a conveyor if it is a fixed motion. So uh, things are going to get uh, more automized from now on, and with the demand kicking in the economy, I think the investments will also flow in.
Yeah, thanks, Mr. Avnav. So the next question I have for Ms. Sheenu. So we all know that the healthcare workers are on the, front line to battle with the coronavirus. Their dedication, their commitment, and their courage actually deserves our deepest gratitude and admiration. So we all know that. So, Ms. Chinu, I have a question. From the feedback which is coming from the session is that how challenging it was for you to keep the morale up of your employees, of your health workers during this pandemic, because I believe this is the toughest time they have worked.
Absolutely. First of all, I would like to congratulate Mr. Hemant Rajput. That was an excellent presentation, very much in depth and gave a lot of insight. Really brilliant, especially from the healthcare perspective. All of these things we were taking care of as well in our organization for the people. So, having said that, Mr. Vivek, yes, indeed, it was a very, very tough time. You will not believe that apart from the doctors and the residents, even the drivers, now the drivers became very important, right? Because they're the carriers of the people. There was no transportation. So if we start thinking about that, the people had to come from their houses to the hospital, and there was no local transportation available. So the drivers also became very, very important and key in bringing these people from their homes to the hospital. Now, a lot of these people were staying at other places as rented accommodations, and where they were staying, their landlords wanted to evict them because they were working in the hospital, so they felt they're going to carry the infection back. So we had to start thinking not just of the frontline workers, of the people who were giving the care, but even of the people who were actually at the very ancillary level, but who were very, very important and key to this entire operation. With the doctors and the nursing staff, of course, things were very difficult, and we had to follow all the procedures. With a lot of elderly people, we did not want them to come to the hospital at all. So it was challenging, but it happened.
Yeah, thanks, Ms. Shinu. I can understand that how challenging it was, because being in the same industry, we are working in administration. For us also, it becomes difficult quite some time. But this session definitely clear most of the doubt which all of us are having. So, Hemant, for you, I have a very tricky question. So this question has been asked by Colonel Ashok. So he wanted to know that are we already across the channel, or do we see that there are chances of second wave? And if so, then more changes are we likely to see? And like, I mean, like lockdown or anything else? So any idea what is going to be happen?
Yeah, in fact, that is a question with many of us have, and we occasionally discuss among our circles or within the groups that we are closely working with. Uh, my sincere wish it doesn't happen, that it remain the way it is as of now. But we still continue to see stressed numbers like in the state of Maharashtra, in Kerala. Kerala specifically, I'm mentioning, because that was one of the state who controlled it initially very, very well. But right now, if we see, so these are the two states which have the maximum number of cases in the country. We are seeing some severe waves in the European countries, who are very, very badly hit. And now some of those countries are even in a stricter lockdown condition. So my sincere wish is that it doesn't happen. But as I said in my last slide towards the emergency preparedness, it's very, very important that we don't take things still very, very lightly. The vaccination for the general public is still a couple of weeks away to be rolled out by the government, while we have around 1 crore 10 lakhs people given a shot for the first dose. But we are a large population, and at the same time we also see some worrying trends in the general public, wherein people have started thinking that the pandemic is far over, which is actually not the case. We are still fighting the demon, and we must continue to keep our guards on as well as remain vigilant. uh, I wish we overcome this pretty soon, but let's keep the guards on. And as I said, let's take cautious steps. Let's not rush into 100% operationalizing everything at one go. Have a fallback plan ready. That's my recommendation.
Yeah, thanks, Hemant. Just adding to that, if you can just share, since we all are from the facility management group, so and employees, we are expecting our employees to come back to office and work. So, what all the things which employees are really expecting from us, and they want to see in the campus? So, some key things which actually we need to take care of.
Yeah, sure. So see, I believe that the proof of the pudding is in eating, right? So if an employee comes to office for the first time after they have been working from home for a long time, so when he comes to the first time, he must have the things visible, which gives him or her the confidence that my workplace is safe, where I can say feel equally safe as I do at home. That also includes your transportation from home to office and back, right? So beginning with transport, if you have those sanitization practices, if you can create a safe work environment where things are sanitized, kept absolutely clean, sanitized very frequently, you can ensure your social distancing, and everybody in your office is equally aware and responsible, behave responsibly in a way that they are still fighting this pandemic, but they are protected in a way, they are aware and they are fighting it together. So I think that to prove what they will be able to see will do more wonder than just plain talking or sending out the communication mailers. And then from there, it should be the word of mouth. When I'm coming to office for the first time, after going back, I'm talking to my parents, my family members, my another 10 colleagues, and telling them that, okay, I today went to office, felt safe. This is something which I liked, and I may be going again tomorrow. So that gives another 10 guys that confidence that they feel equally safe to come back to office.
Yeah, thanks, Hemant. So, time is running out, but I have a last question for Ms. Shinu. If she can put some light on vaccination part. because it has become a question now that whether the one should take it or not. So if you can just throw a light on vaccination, I mean the pros and cons, if there is any cons of it.
See, so this is a very interesting topic, Mr. Vivek. There will always be a consequence of any injectable that you're going to take. There's always going to be a consequence of any medication that you're going to take or a surgery that you will get done. But what we have to see is that which is the bigger of the two evils? Is it because of the vaccination, or is it because of the disease itself, which is going to happen if we do not get ourselves vaccinated? So I think vaccination we have been taking for polio, rubella, mumps, for all sorts of things. We must take the vaccination when it is available for us. If there are other comorbidities which affect the what's going to happen to the body after we get vaccinated, that is something that the healthcare people will advise you on an individual use case basis. Secondly, we also develop a herd immunity. What is the herd immunity? That sometimes we are very capable of handling a disease because our immunity is very strong. But we become carriers for that problem for the rest of the population or the people, the community where we are moving around, where most of us are immunized because of the vaccination or because of our internal strength. Then we do not, we create a community which is a stronger community. And it is a scientific fact that when that happens, then the disease progression automatically goes down. Now, summing this up, there are two kinds of vaccines. One is called the active vaccine and one is the inactive vaccine. What is the difference between the two? Polio, rubella, etc. are examples of this. That active vaccine is when the the virus which has a disease-causing problem has been, it has been reduced. And the inactive vaccine is where it is cut into parts where the disease-causing problem is not just reduced, but it's not there. So I will not delve into the scientific basis of this, but when we talk about different vaccines like the Covaxin and the Covishield or the other vaccines which are in the market, this will be the basic difference between the two. So Covaxin example is an inactivated or a dead vaccine. Therefore, the side effects are less, but the efficacy is also less. Covishield is a live vaccine. It's an active vaccine, which means the side effects will be slightly more, but the efficacy is also more. So I think beggars can't be choosers. As long as whatever vaccine is available to us on the market right now, and we are privy to that vaccine, and on a use case basis, the doctor says we are okay to take that vaccine, we are okay to be inoculated with that vaccine, we must go ahead and get ourselves vaccinated. In future, of course, we will have a chance and an option which we can exercise. But as of now, I think this is a boon that we have this option available to us.
Yeah, thanks, Ms. Shinu. This was the last question from my side. Now, Mukesh, you can take this forward.
Thank you so much, Mr. Vivek. So before we end this session, I would like to convey just one message that we have dealt very well till now with this pandemic, but the real test starts now. Those who has nothing to do outside the door need to stay home, and that is our utmost priority, because we have children at home, we have elder people at home, so they have nothing much to do outdoors, so we should keep them inside. And we should be extra cautious and adhere to the guidelines issued time to time, keeping our house ventilated, trying to put double mask as and when, to avoid the risk. So and very, crucial request is that we should not take it very lightly, as nowadays I see people taking it very lightly. So this is my request. And now we have come to the end of the session. I would like to express my gratitude to all the eminent speakers and guests to spare their time, despite being Sunday, it's a family time. So thank you so much, all the speakers and all the participants. Now, may I request our mentor and leader North Zone, Colonel Ashok Prabhakar, for the word of thanks. Over to you, Colonel sir.
Thank you, dear. Thank you, everybody. Thanks, Abhinav, Ms. Shinu, and of course, Hemant. It couldn't have been better. The talk was wonderful. Thanks to each one of you, the kind of effort you had put in. Abhinav, starting with you, I think you gave a wonderful start to this activity. The examples that you quoted, personal examples that as a director in your organization, the tasks that you performed, can make out that you've been leading from the front. The standards that you've set in your organization, naturally, when the top management is involved in day-to-day activities, the tasks are going to be performed similarly at the lowest level also. It is showing in your activities, showing in the results, you getting accepted at the international level, an organization like ours getting accepted at the international level. I think kudos to you. It calls for a real appreciation. Good. I only appreciate and wish and hope that you continue to perform in the same manner and bring laurels to the country. Thank you. Thank you so much, Abhinav. Coming to Shinu ma'am, I think again a wonderful presentation. The way you spoken about it, the way you told each and every activity that you've done, be it in terms of the labor laws which are going to be coming in, OHS, how it is going to be, occupational health is going to be coming up in a bigger way, including the legal aspects which are going to be coming in. The aspect that you mentioned, be it in terms of re-engagement, be it in terms of usage of the social media that you all have been doing during this last 1 year, the changes in the infrastructure, the wellness officers coming in to replace the safety officers. I think that's a good concept. It is coming in here. I think we should be ready for that, and we should prepare ourselves for that. Those of us who have an interest in this kind of activity can come forward and align our skills and interest into this thing. The HR has a greater responsibility. Absolutely, HR has to come forward and find newer ways of keeping the interest of the soldiers in the organizations alive. The housekeeping officer you mentioned that has got a greater task, greater responsibility. Absolutely, be it hygiene, sanitization, infection control, all these activities. So COVID is, like we all have been saying all this while now, the COVID is here to stay. That means our efforts which have started in this direction are here to stay. So we have to only make it as part of the SOPs. Be it in terms of other activities, you mentioned about those various biases and the comorbidity bias. I think that's a wonderful discussion. The comorbidity bias also is something that is coming in, and we got to be careful about that. We got to be keeping that in mind. I think wonderfully done that on that, ma'am. And coming to Hemant, of course, Hemant, I think a wonderful compendium you made today. We just, in fact, I'll request the organizers that starts with you only, Hemant. Of course, Kal VP, Ishu, Vicky, Vivek, Saxena, Mukesh, you all, the Rajasthan team has done a wonderful job. What can be done is this complete activity, the presentations, the speakers are okay with that, the presentation, their part could be shared, and thereafter then, we can have a compendium of activities to be done post-COVID. Hemant, of course, yours been a wonderful compilation of each and activity of the services department, how each activity is going to be addressed, which from your presentation I can make out why Infosys is so blessed to have a leader like you in the services industry over there. Naturally, the organization would be gaining from your experience. So wonderful friends. I can only say that the topic chosen by the team, Rajasthan team, was wonderful. It only shows in the participation that we had a cut at 100, and we exceeded that. Of course, our friends thereafter joined in from YouTube, and I can only say on a Sunday, if you're hitting a century, it is equivalent to 1,000 on a working day. So that is kudos to your team, kudos to the effort that each one of you has put in to bring it over there. Kuldeep, again, you all been putting in great effort. Thank you so much. Thanks once again, Abhinavji, Shinu, Hemant, and Abhinav and Shinu. We look forward to seeing you more often. This platform is a knowledge sharing platform where each one of us comes and contributes, and in our contribution we learn also. We are getting from your experience. Somewhere this industry of ours, where we have in this organization of ours, where we have 5,500 members already, each one coming from a different organization. Each organization, going back to at least on an average about 3,000 employees. It turns into millions and millions of families thereafter that who are getting associated with GACS. So ours is a wonderful chapter where we are doing activities for all across, be it members out here, be it the families, be it the kids also. So those kind of activities are in place. Thank you for joining in, and we'll suggest and request that you be associated with us. I'm sure we'll have a lot to gain from each other.
Thank you, sir.
Thank you so much, folks.
Thank you so much. Thank you.
Over
Thank
to
you so much,
you
sir.
all. Yeah.
Thank you so much, sir, for this wonderful feedback. And on behalf of entire GSCS family, I once again congratulate and thank all the eminent speakers for the wonderful, presentations and enlightenment. Over to you, Jatin. Thank you.
No, once again, thank you so much, all our speakers and the audience. It's been really wonderful, and we are glad to see uh, such a fantastic participation on Sunday. Hemant, you were right. We can definitely go ahead and keep our webinars on Sunday from now, looking at the participation. And we'll definitely come up with more knowledgeable sessions for our members. Thank you once again. We are signing off now. Thank you.
Thank you. Thank you, everyone. Thank you.